our organization, MaineHealth, and one of our facilities, Maine Medical Center. My name is Odette Periel, and I'm the Vice President of Patient Care Support Services at Maine Medical Center. And hosting with me today is...
Hi, good morning. My name is Melissa McManus. I'm the Director of Talent Acquisition for actually all of MaineHealth. So we support all the entities within the system.
Great. We are here to talk about who we are as MaineHealth. So who's MaineHealth? We're the largest healthcare system in Maine. We have 22,000 team members, 14 facilities, of which 12 are community hospitals. We're spanning from the coastal region through central Maine, southern Maine, all the way to northern New Hampshire. We also have 3 affiliates, and our largest hospital within the system is Maine Medical Center, where we are licensed for 637 beds, and we have a team of over 9,000. So our vision, what is our vision? Our vision is to work together to create the healthiest communities in America. And our mission is, as a not-for-profit health system, we're dedicated to improving the health of our patients and communities by providing high-quality, affordable care, educating tomorrow's caregivers, and researching better ways to provide care. We're about to show you a video that captures our values in actions, and you can hear from several of our team members who are not here with us. As you remember, I said earlier, we do always travel with an entourage. So Andy, could you help with queuing up our video, please? What we can do is just transition into our first panel, which we've invited 2 of our team members, Melissa Fairfield, and we have Andre Eason, who will be just talking to us today about how they put the values into, bring the values to life. So I'm gonna have Melissa and Andre just introduce themselves, and then we'll come back to the video later. Melissa?
Hi, can everybody hear me okay?
Yes.
Awesome. I love Zoom meetings, especially when there's tech issues. So my name is Melissa Fairfield. I'm a registered nurse here at Maine Medical Center. I've worked here for 18 years, with the last 17 years being in the emergency department. I started as a staff nurse, then as a nurse educator, and for the last 5 years, I've been a nurse manager. I also oversee Urgent Care Plus, which is on the Brighton campus, and the hospital's special infectious disease program. Very soon, I'll be moving to a new position as a nurse director on an inpatient unit here at Maine Med. I was asked to say why I like working for Maine Med and MaineHealth. Personally, I enjoy being part of a team that's committed to providing the best possible care for patients, but also is committed to each other and looking out for each other and supporting each other. Healthcare is really a team sport, especially where I live in the emergency department. And everyone's role has tremendous value. And I feel like overall there's a true culture of appreciation for each other here. And that's definitely the kind of environment that I enjoy being a part of. We are, as Odette said, really a culture that's rooted in our values. And I was asked to give examples of 3 of those values: innovation, respect, and patient-centeredness. We actually have a whole formal arm of innovation through MaineHealth, but the culture of innovation really extends all the way down into each department, and staff are encouraged to bring forward ideas for improvements through shared governance, which is staff having a say in everything that happens. As far as innovation within the emergency department, we previously often had significant wait times for patients in order to be seen by a provider. And over a course of months, bedside staff and leaders got together and really looked at how we could do things differently, and we revamped the entire initial care process for ED patients. So now patients are seen by a physician as soon as they arrive at triage, and their care started much more quickly, and often they may have their care completed before they even get to a room. So I think that's innovation in action. For the value of respect, a good example is Maine Med and MaineHealth's participation in last year's Pride Portland Parade. It was the first time MaineHealth was officially a parade participant, and we were able to, staff actually got to organize that and what that looked like, and we had over 150 staff march in the parade with their families and their loved ones. We then celebrated Pride Month here at MaineMed. And most people you'll see have stickers on their badges, which is really cool as a member of the LGBT community myself. It meant a lot to me personally that the organization was publicly showing their support for their employees. And it really, I think, helped increase the sense of inclusivity and respect within the organization itself.
Right.
And then for patient-centered, I could tell you a million heartwarming stories of the care of patients because it happens all the time, every single day. I think that value is constantly exemplified. But honestly, it doesn't matter if your role here is as a nurse or a trauma surgeon, an EVS employee, an engineer, an admin, or security. We're all just constantly working together with a common goal to support our patients. That's really our guiding light. And whether your role is at the bedside or not, we're all here for our patients, and they're just the center of what we do all the time.
Thank you so much, Melissa. I will be coming back to you to just talk a little bit more about the ER and the work that's done there. And for those who may have watched that series ER, this is not really what happens. Or if you watch Grey's Anatomy like I do and you say, yes, that sounds exciting. It is exciting work and it's great work, but so far removed sometimes from the reality. So we're going to come back and talk to you a little bit more, Melissa, about that.
I do apologize. I have to step out briefly for the Joint Commission, but I will be back.
And that's truly what happens in operations. Thanks, Melissa. Andre, flipping it over to you.
Good morning, everyone. My name is Andre Eason, HR partner here at MaineHealth. I've been at MaineHealth for almost 3 years, and I started out within our talent acquisition department, working with Melissa McManus, and working with hiring managers as well within our IT department and other areas to find great talent such as yourself to work with a great organization. I'm now part of our HR partner within our hospital system and work with more than 2,000 employees on a daily basis, from employee relations, compensation, and planning with managers for future opportunities. The best part about working at MaineHealth is the community and having that sense of helping individuals in more ways than you can ever imagine. Back to our values. Wish that video played because it's so awesome. Our values are deep-rooted within our organization, and the three that I handpicked were integrity, excellence, and ownership. In regards to integrity, we have taken a stance and are currently laying the groundwork with our DEI program, headed up by Director Ryan Polly. Ambassadors are being appointed, and MaineHealth is at the front fork of change right now within that sector. In regards to excellence, each year we kick off the United Way campaign, and the focus of this is to support our patients, friends, and neighbors. This year we're partnering with Maine Behavioral Healthcare Outpatient Services in regards to Project Brace, building reliance for adverse childhood experiences, and MaineHealth the Children's Initiative, Early Childhood Education Collaborative. And in regards to ownership, as we braced for the pandemic, MaineHealth stood by its employees and immediately jumped into action to get them working from home safely and furloughing with pay any employees that could not work from home due to the nature of their current positions. And we're still doing that initiative to this day. The best part about MaineHealth is all the people that we work with that are on this call currently, and all of you. Thanks.
Thanks, Andre. So as you've heard from both Melissa and Andre, our values are something that we bring to life on a daily basis. As team members, we know we can count on each other. I did reference ER, and I did reference, George Clooney was in ER, just so everyone knows. And I did reference also Grey's Anatomy. The one thing that both of those shows actually capture, which we do, is the community, which Andre spoke to. It is really alive and well. The community that we create here at the hospital, how we work well with each other. I think everyone who is on the panel today, from Bailey to Marie to Kevin to John, would be able to, and Andre and Melissa will tell you that we are constantly working across departments, across service lines to make sure that the patients of our care, the care of our patients is of utmost importance and they get the best care. So that's something that's really true and alive and well here. Andy, were we able to work out the video? If not, we can keep rolling.
I think it should be all set now.
All right, so we'll show you this video and then I'm gonna hand it over to Melissa.
MaineHealth has embarked on one of the most profound initiatives we have undertaken as a system, the creation of a common set of values.
Patient-centered.
Respect.
Integrity.
Excellence.
Ownership.
Innovation.
It's been a collaborative process that has engaged thousands of team members and leaders from across MaineHealth. Our shared values not only shape our collective culture, they define the kind of experience our patients, families, and those we care for can expect wherever, whenever they interact with us.
Can we have everybody's attention over here to group one?
Employees representing all of our member organizations came together to discuss and define how we bring our values to life.
When I've made the mistake, I should go offer solutions or ask for help.
They really emphasized positive attitude.
What can we always continually do to be better?
We want these things to be our culture.
This is probably one of the most important things that we've done as our system. There's no better way to come up with system glue than to have values that everybody believes in across the system, and that we have a common set of values so that we can describe to ourselves and outsiders what we stand for.
This is a great opportunity for us to sort of sit back and talk about what really is important in all of us in our daily lives.
All employees that we work with had input, had an opportunity to be a part of this. We have to live these values.
Exactly, and to embrace them, they have to come from the bottom up.
It's been really collaborative. Everybody's voicing their opinions.
Like anything, when you have a hand in it, you tend to apply yourself more to it.
What's next is to live what we talk about today. That means embedding them in performance evaluations. It means embedding them in all of our actions and all of our activities.
Thank you. You're welcome. Have a good day.
We are all ambassadors for our values. How we interact with our patients and with one another is at the very core of living our mission and vision. Working together so our communities are the healthiest in America.
I think in the end, this is going to be all about better patient care. MaineHealth is about the health of our community. And this is a great opportunity to put all our values into play so that our patients in the end will do better.
We are our values. We are MaineHealth.
So before I turn over to Melissa, thanks, Stacy. I like that. Again. Before I turn over to Melissa McManus, Melissa Fairfield did mention that she had to step away because she was needed for a Joint Commission survey. And that is currently going on. The Joint Commission survey is a week-long survey where we have, actually this time we had 10 surveyors who came to us on Tuesday, and they do this every 3 years. They're sent by the CMS, Center for Medicaid and Medicare Services, to evaluate our standards and our care that we give to our patients and our leadership as an organization to make sure that we are living up to the expectations. And if not, then they do have the ability to shut our facility down. So this is for us a really big thing, and every 3 years we go through this. So we're having this now, but we still felt the need that this was really important for us to also be able to present to you as well, to show, because this is stuff we do on a daily basis. And you know, when the Joint Commission comes, we're happy that they're here because this is our checks and balances. So I appreciate Melissa stepping away, and I know once she gets back, any questions that you have for her in the ER or in any of the roles that she has done or is going to be doing, please feel free to post those. So Melissa McManus.
Thank you, Odette. All right, Andy, if I could ask you to pull up the presentation. I know we just reviewed our values, which as someone that came from the for-profit sector, and 4 years ago I joined MaineHealth, to come from that side to move over to the nonprofit mission-driven organization, I can say that is the top benefit working here. I feel like my day-to-day work is meaningful, and even though I'm not in direct patient care, I know the work that I do here every day plays a huge factor in that piece, and it's very satisfying working for an organization where you feel that your day-to-day is bigger than you. So I just want to start with that. But Andy, if you could go to the MaineHealth benefits view, page 6, that would be wonderful. So part of becoming a unified system underneath the MaineHealth umbrella, where we have the separate organizations, is we've done our best to align our benefits. So if you're working at Maine Medical Center or Southern Maine Healthcare, or actually Midcoast was actually one of the affiliates that just joined in Brunswick, just joined our organization. I'm really excited because full-blown January 1st, they're going to be part of the team that I work with, which is really exciting. But I just wanted everyone to be aware of the benefits that MaineHealth does offer to us. It's not strictly just that healthcare, the healthcare piece, but we do have 2 comprehensive health plans. We also have a vision and dental plan, short and long-term disability, paid time off, which I'm going to be honest is very genuine. It's a large sum. I feel I can't keep up with my paid time off using it, this is really exciting too. Parental leave for new parents. New parents are eligible for 4 weeks of 100% paid time off for the arrival of a child. So that includes those dads out there. So I think that's unbelievable. And I had an employee that joined our team and became a new dad within his first 6 months and was able to benefit from that. Adoption assistance, we have a retirement program and life insurance, flexible spending account, and this is huge. We have tuition reimbursement, so eligible employees, so that's anyone who's in a position that is benefit eligible. So unfortunately per diem positions aren't, but however, eligible employees may receive assistance annually to encourage seeking educational opportunities that would enhance their job knowledge and skills of up to $2,000 per year. We also have employee health and wellness programs. It's called Virgin Pulse, and every day you can track your steps or your activity, or just if you had a good night's sleep, tracking those things, and you actually get points that turn into dollars. So we celebrate good self-care. And we also have an employees assistance program. It offers confidential counseling. I believe it's up to 6 free sessions for that. Online screening tools, self-help tools, and information on wide ranges of issues. So it really covers a wide range of who we are. People are complicated, right? So I really do feel supported in the package that comes along with my paycheck. It's not just that, it's these benefits that are provided to me as an employee as well. So next I wanted to jump into workforce development. I believe
Alexa, I think Stacy has a question there.
I have 2 questions for you, and I think they're for Melissa. So within the benefits, is there a loan forgiveness program at all for students who might be coming out of college with some debt?
Sure. So that is not actually a system-wide benefit we have. However, I do believe, and I am happy to take down contact information and follow up on that. We do have, I believe, one entity in the coastal region that does provide that. So I can look into that more.
And can you just kind of review the application process? And within that, is there a number of times you can apply for a position before you can't apply anymore?
Yeah, actually that is going to be part of the presentation as well, but happy to answer that question now. So our system does allow for up to, I believe it is 5 active applications within a 2-week range. And after the 2 weeks, you can apply for 3 more opportunities. Also, if you do hit that limit of 8, it is okay to call our department, which that contact information is in here, and say, can you give me an update on my applications? Also within your profile in our system, you can see the status of those to see kind of where things might be pending.
It's fantastic. Thank you.
Absolutely. So I did want to talk about, I believe, if it's all right to, yeah. So right now I would like to share a little bit about workforce development. Andy, if you wouldn't mind going to slide 9, I believe. And really slide 10 would probably be best. So
that's a beautiful slide 9.
Yeah, so this is the one. So within talent, so we have a whole department called talent, which is overseen by my VP, and we have talent acquisition, which is one bucket, but we also have and then we have physician recruitment and we have executive recruitment. But another wonderful team that we have here is actually workforce development. So we are looking to grow our own employees and learn about opportunities. I know myself, not coming from a healthcare background, I wasn't aware of all the variety of opportunities there are within healthcare. So this department is supporting from every angle you can think of. With Odette, her department, patient care support services, she actually partners closely with workforce development, as there is an English course that is provided for employees here if English is a second language. So we want to develop our team members. We also have different apprentice programs, and I believe Bailey will be able to talk about that a bit. We also have an MA apprentice program. We have a CNA course, which is a wonderful, a majority of those that graduate from that program end up as employees here, as well as Surge Tech program. We are currently, I think it's okay for me to say this, currently developing a sterile processing tech program. So the opportunities are really endless. But another great piece about having the Center for Workforce Development is if you're someone that's not sure about where you want to take your career, but you know MaineHealth is your home, there's so many opportunities here. This could be sort of a career navigation and guidance assistance within this department. So I know as someone that has had the opportunity to grow here, it's definitely such a benefit to have a department and a resource to go to. So that being said, I would like to introduce our next panel. And I just want to make sure I have all, I'm not sure if we could go to the next slide there, Andy. Oh, whoops, maybe we don't have I guess that's not the right one. However, I will introduce, we have Kevin O'Connor on here, who is the Director of Nutrition Services. We also have Marie Jenishuk. She's a nurse manager for the Cardiothoracic Intensive Care Unit. We have John Zahor, who is the Cardiac Cath Services Director, and Bailey Eels, who is the Director of Patient Access. So Kevin, if you wouldn't mind kicking off, we've asked the 4 of these leaders within our system, they all are Maine Medical Center employees, ask them to highlight the different career paths within the categories that their job categories they work in, as well as share their backgrounds and how they've grown within the organization. So Kevin, thank you.
Usually they save the best for last, so that's why I'm going first, I guess. My name's Kevin O'Connor. I'm the Director of Nutrition Food Services here at Maine Medical Center. I'm just going to give you a little of my journey and how I got here, and then I want to talk a little bit about our overall division, which is Patient Care Support Services. So I graduated back in a long time ago from the University of Massachusetts, and I was an economics major. I then went to work for Sky Chefs, which did in-flight catering and was a subsidiary of American Airlines. And I worked there for 5 years. I gained a lot of operational food service knowledge and also got some management skills, which hopefully I can carry with me till today. And then I went into healthcare food services. I worked in the partner system down in the Boston metropolitan area for 25 years. And then fortunately enough, I was able to come up to Maine, and I've been here in my capacity as Director of Nutrition Food Services for the last 8 glorious years. Here, my position, I have 5 managers that report to me, 9 supervisors, and just over 200 employees, which we like to call team members here. We do all the patient feeding here, all the tray service. We have 3 off-site retail operations in cafeteria capacities, and we also have our main cafeteria here at Maine Medical Center. We will do 1,400 trays, patient trays per day. That's breakfast, lunch, and dinner. We'll do over 3,000 transactions a day in our retail operations. We'll do 250,000 in catering, which is both internally and externally. And our retail operations bring in just about $4.9 million this year alone. My budget for operating expenses is $10 million, and we have the registered dietitians. They'll do over 60,000 consults this year. The positions that we have available in our operation is food service workers. We have cooks, we have diet technicians, and registered dietitians, which work with the patients and their special diets. And we also have cashiers in addition to the supervisors and management positions that I just mentioned a little earlier. I work up for Odette, with Odette, in patient care and support services. And I'm just kind of representing today the various departments that report up to Odette. We have environmental services and transport. We have security and parking. And then we also have clinical engineering. The environmental services do a great job. They're a very proud department. They work like a fine hotel. If you walk into a hotel, it's nice and clean. That's what they bring to us here at Maine Medical Center. And I think they might even take it one step further, because they are very, very versed in sanitizing and cleaning both all the patient rooms and all the ancillary areas within the department. The transport department, they transport obviously patients throughout the hospital, and they also transport equipment to and from rooms and throughout the hospital where needed, and they do a great job in a very timely manner that is really needed to make us operational and efficient throughout the day. Parking and security. Security does a great job keeping everybody safe here at the hospital. They're very engaging. They're very customer service focused. In fact, and there's some upward there. In fact, recently the manager who was just promoted to the director position will do a great job, and that kind of opens up some other positions in terms of managers and supervising with a dominoing effect, because we do like to try to promote from within as much as we can. Another tidbit on that too is probably in the last 10 years, the security department has, I don't want to say promoted, but security officers have taken police officer jobs in the various main cities. So, I mean, there is some opportunity there, and it's a really, I hate to say it, but a nice breeding ground. We hate to lose our good people, our good employees, team members, because we like to keep them here, but we're really excited when they can go out and really help out the community and also help out Maine Medical Center in a sense. And then we have clinical engineering. Clinical engineering is a very technical department. They keep our equipment at the highest standards, operating and functioning, which is extremely important. They take care of all the pumps, all the machines that monitors that keep patients safe and well to get them better. But it's technical, but I think they can train the right individual with some skills and somebody who's really willing to learn. So that's very important. And then just in conclusion, I just kind of want to say that there's lots of, Maine Medical Center is one of 12 hospitals within the MaineHealth organization. So, we here at Maine Medical Center are very close to your school, but there are opportunities within, throughout the state. So, I mean, keep that in mind, and that's very important to know. We have a lot of different shifts. We're open 24/7. It's really conducive, certainly in my area and other areas, for students working and also, you know, taking their classes and getting their education. So we can be pretty flexible with per diem, part-time shifts. And we really, it's a win-win because we love having the students here. They bring energy to our staff, and you know, they're very intelligent and smart and really fit a void that we need staff for. And the last thing I want to say, and this is not a sales pitch, I just want to say I really love working here at Maine Medical Center. I'm very, very happy and excited to be here for the last 8 years. I hope I can do another 8, but I am getting pretty old, but we're not going to go down that road. So there is opportunities here, and we'd love to have students and new team members to join our facility. Thank you.
Thank you, Kevin. That was great. I hope we get you for at least another 8 years. All right, Marie, if you could share your background with us, that'd be great.
Sure. My name is Marie Janishek. I am the manager of the cardiothoracic ICU. I've been a nurse, man, it feels like a very long time now, but it's coming up on 20 years that I've been a nurse. I've been a nurse at Maine Med for, this is going to be my 12th year here. And I started out at the bedside when I first came in the CTICU. And so our department, we take care of patients who've had any kind of open heart surgery. And so we, your patients that have had bypass surgery, that's they come to our department. Any patient who's had valve surgery, any patients that have had left ventricular assist device. I know we have quite a number of patients in the community that actually have those devices now. They come to our department. So that's our patient population. I started out at the bedside working with these patients, and eventually I decided that the management track might be a place for me, and I moved into the position, and I've been in this position for the last 7 years. And during that time, I've seen quite an evolution at Maine Med. We added the CNA classes. We developed our own CNA program, and through that, I have seen people move career paths and have become nurses along the way. So definitely, as Melissa said, there is, it's endless how you can grow at Maine Med. I've seen folks start out in our EVS department. They've gone to our CNA classes, and they are now working with us on the floor, and they are going to nursing school at the same time. So Maine Med definitely opens many doors for you. My department and all the ICUs here, we do take new grads, and so some of our folks that have gone through the career path and have become CNAs and have gone through nursing school, they are now new grad nurses on our units. And it's such a wonderful thing to see as people grow and they've decided to go down this path and develop, and we're able to help them to move along that way. Here in CTICU, it's a very niche population. It's an ICU, but we take care of a very specific population. We do have currently 6 ICUs at Maine Medical Center. So if the CTICU is not the place that you'd like to be in, we do have a trauma ICU. offering burn care in that trauma ICU, a neuro ICU, and we also have a medical ICU and a cardiac ICU. And now in the times of COVID, there is also a COVID ICU. So it's endless where you can decide to work and grow and learn. And you can work between these departments. The nice thing is that there are folks who decide that they start out in the medical ICU and decide that they want to learn a new skill, and they either go to neuro or to the CTICU or to the cardiac ICU, as a matter of fact. And we do cross-train between all of those places. So if there is, I would say I am very biased in terms of nursing, and I think it's a wonderful, wonderful place to work. You get to work with the community when they are at their worst and help them to recover their health and get to a really good place. MaineMed offers that opportunity, and like Melissa said, we do offer tuition assistance, and so the ability to grow and change career path is endless. For my department, many staff nurse, as they get to their 3rd or 4th year, they decide that nurse anesthesia school is where they'd like to be. And we also offer the opportunity to be able to a pathway to go to nurse anesthesia school and come back and be a part of the MaineMed anesthesia team. So the career path here is endless in nursing. You can take the track to be a clinical, a professional clinical nurse, meaning you can go to nurse anesthesia school. You can become a nurse practitioner. You can become a critical care nurse practitioner. And if you want to take a leadership track, there's endless opportunities that you can be a manager, a nurse manager, you can be a nursing director, and you can be a nurse educator. We definitely need a lot of those. And right now we're at the point where we are, there's a looming nursing shortage. Some say that we're currently in that shortage, but there's a looming nursing shortage. And so for folks who are thinking about this career, this is definitely a place that you can build, grow, learn, you can give back to your community, and you can become part of a really good organization that provides a lot of good support, not only for the staff members that are here and the people that are part of MaineHealth and MaineMed, but also for the community. And you know, there's a lot of you get to interface with the community a lot in terms of providing services, but also building services to make things better. So if nursing is a career path that you're interested in, I would say reach out, and you know, I'm happy to mentor. I'm happy to partner with people. I'm happy to show people around, and I'm definitely happy to share whatever I can to get people to think that this is a track that's easily attainable. It does take a lot of work, but it's definitely easily attainable.
Awesome. Thank you so much, Marie. And John, if you could share Allied Health World with us, that would be great.
Sure. So my name is Jonathan Zahor. I work as the director of the Cardiac Cath Lab and EP labs at MaineMed. We are a catheter-based procedure platform where we do interventional procedures on, I guess, simply the plumbing and the electrical systems of the heart. So we will do procedures where people have blockages in their coronary arteries, the arteries that feed the heart with blood, or the electrical components of the heart that regulate how the heart beats. So we have folks from all over the community who have various degrees of these types of problems, and so we bring them in and we do catheter-based intervention. So we can open up the blockages, a procedure called an angioplasty, or a more common procedure these days is for people who are in atrial fibrillation. One of the electrical components, we do ablation procedures to help eliminate the dysrhythmia and allow them to come off blood thinners and things like that and get them to feel a lot better. My path here was a student I was originally at USM as an exercise physiology grad, and went to Southern Maine Community College for a associate's degree in cardiovascular technology. I did my clinical rotations here at Maine Med, which helped sort of nurture and foster my career. I graduated and started now 17 years ago, and time flies, let me tell you. I never would have thought it would have been that long, but here we are. I worked for a number of years as a cardiovascular technologist in the Cath Lab. I became the Cath Lab manager, was manager for roughly 6 years, and I've been director for the last 5. That time has given me a lot of opportunity to meet a lot of great clinicians. As a technologist, we work hand in hand with X-ray techs who have a million career opportunities here within the hospital, not only in the cardiac world, but interventional radiology, diagnostic radiology, MRI, CT. There's different therapeutic approaches as well. I work with nurses. I work with Marie. She's within our service line as well as a cardiac service line. So we work with the ICUs. We work with cardiac surgery, with the cardiac ICU. We work with the med tele, or people who are on, on telemetry to look at their heart rates while they're in the hospital. We work with everybody, and as a member of leadership, I get to work with people all across the hospital to find common solutions to problems, because this is a big place and we deal with a lot of extremely complex illnesses. We can look at COVID, for instance. The attention that the hospital has taken to try to make sure that the community is safe, that the employees are safe, has been a huge undertaking, and really the hospital has done a wonderful job of paying attention to that, making sure we're where we need to be, which is part of why the state is in such good shape relative to our peers throughout the country. So it's really a huge community. It really is a team endeavor. I know Melissa Fairfield mentioned that earlier, and Kevin mentioned as well, and Marie. It's all about team here, and it doesn't always feel like everything's rosy because we deal with a lot of heavy stuff, but it is, those are the people you lean on to make sure that you're successful and that we're providing great patient care. And we do. I mean, we're consistently ranked very high within national rankings for our services, and it's something we're very proud of. As an individual who works with patients, I'm very proud of that. And it's something that I think any prospective person who's looking to join healthcare should look at a hospital like Maine Medical Center and say, that's what I want to be part of. I want to be part of a team who is dedicated to their craft, dedicated to the community, and want to make sure that we're all in this together. And when times are tough, there's a team and a community to lean on to make sure we all reach the common goal.
That's great, John. Thank you so much. And I couldn't agree more with everyone saying it's so team oriented. I am so thankful in my role that I get to partner with all of you and other leaders across the system, and phenomenal. So great. And Bailey, if you could bring us home, that would be great. Oh, Stacy, I think you may have raised your hand.
Yeah, let's have Bailey do her thing, and then we have a bunch of questions. So I just want to make sure we get to them. But yeah, Bailey, take it away.
Okay, great. Thank you.
Hi. Hi, everyone. My name is Bailey Eels, and I'm the director for MMC Patient Access. I'll be talking to you a little bit about MaineHealth patient access and MMC patient access. But before I jump in, I will give you some more information about my background. I've been with Maine Medical Center for 13 years now. And you're right, time sure does fly by. I started here at the front lines while I was working on my pre-med degree. And I was really, I had my mind made up. I was dead fast on going forward with a clinical degree, specifically a physician assistant. And I had my EMT certification. I was just like straight on all clinical. But once I started in patient access, I really found my home. I found my passion because patient access touches so much within healthcare, within the hospital. It's a little bit of both worlds with clinical and with administrative functions. So I started at the front lines 13 years ago, and I was able to work my way up to the director. I started in admitting part-time and per diem in the emergency department. Then I was promoted to a coordinator position, a supervisor position, a manager, and now here within this director role. So a lot of opportunities within patient access. And once I understood that my passion was with patient access, I was able to continue to take advantage of that tuition reimbursement. And that's where I moved into an evening supervisor role. We're 24/7. So many different shifts and opportunities there. And I worked on my master's in public health. So again, I got a little bit of both worlds there with the administrative functions and working in the clinical departments. So a little bit about MaineHealth patient access. We are the beginning of the revenue cycle. And this is really important because what we do in patient access, we set the stage for the rest of the revenue cycle and those clinical teams. The work that we do is really important because it ensures that we get it right up front, or else we're affecting everything else downstream throughout that patient's care. And patient access includes a variety of different functions, from scheduling, getting the patient scheduled for their appointment, for their admission. We're checking our patients in for their outpatient appointments. We're admitting our patients for their inpatient procedures, and the most important, completing that registration. And part of the registration includes the patient's demographic information, their really sensitive private health information, and their contact information, and then their insurance information. So confirming the type of coverage and healthcare that they have so that we can bill accurately and timely and receive that reimbursement for the services that they receive throughout the organization. We also, if the patient doesn't have health insurance, we ensure that we partner with financial counseling and we get them to those resources that they may have a need for so that they don't have to worry about receiving that bill or their account doesn't go in bad debt. So we're always trying to navigate and partnering with the other financial counseling and other departments out there to get the patient the resources that they need. Oftentimes within patient access, like I've mentioned, we're at the front lines. So we're interacting with our patients right at the front lines. We're patient facing, and we're often that first face that our patient sees when they present for care at Maine Medical Center or any other department, organization throughout MaineHealth. So it's really important that we set the stage for that patient's experience, always going above and beyond with our customer service every single time. So MaineHealth Patient Access oversees patient access functions at all of the different hospital facilities throughout MaineHealth. So that means we're located all over the state of Maine. So, patient access is here at Maine Medical Center. We're in the southern region within Biddeford and Sanford. We're also in the western region at Stevens Memorial, Franklin and Memorial, and then coastal up in Waldo and Lincoln County. So we're all over the map there. And again, it's really important for the work that we do. We have a good motto that shows our value of ownership. Don't take and don't pass errors, because we're part of that revenue cycle and we're all connected throughout the facilities, MaineHealth, that if we do make an error, it's going to trickle down throughout that patient's care, but also it's going to trickle down from MaineMed to the other facilities that are also on the same computer system called Epic. And so within MaineHealth Patient Access, we also have other divisions like our MaineHealth Pre-Services. They are a contact center. They're not necessarily patient facing, but they're a contact center. So they're completing that registration with the patients over the phone. They also complete the scheduling functions. And then we have an integration team and a training team. So we have many different positions available in all of these different areas. They're 24/7 or the day shift in the call center. We also have career paths within our teams. And so you may be first hired at the apprentice level. And as long as you meet the metrics and other requirements, you're able to move up within the career path. And just given my history, there's so many other opportunities should you be looking for leadership as well. So I'm so sorry if that was rushed. I wanted to be sure to leave some time for questions.
Thank you so much, Bailey. I always love hearing everyone's journeys here and how we're all able to grow. And I'm recognizing the time, and Stacy, you had mentioned questions. So I would like to offer, Andy, if you wanted to give Stacy my email address, I am happy to take those questions offline, make sure I distribute the questions to the appropriate leader to get that answered and return those back to everyone. I also, Andy, if you wouldn't mind, does that sound like an okay plan?
Yeah, that sounds great, Melissa.
Okay, great. I just want to respect everyone's time. Andy, if you wouldn't mind, I did just want to point out a couple things on the slide. If you could bring up page 11. Just got to do a little promo on how to get your application in and learn about opportunities. I'll just share, we have a talent network. So if you're currently not really ready to start applying for opportunities, so it's slide 11, right here. So right on our career site, which is careers@mainehealth.org, and pretty soon you're going to see a QR code that you could even scan, right, if you have your phone. It's right on the front careers page. You quickly upload your resume, so it's a 2-minute task if you already have that resume created, and our system will be able to send you job alerts based upon your interest and skill set, so you know when new opportunities come up. I did see a question pop up about the nursing programs in regards to new grads. As Marie mentioned, we do have those direct opportunities year round. However, we do also host new grad programs where we do hire at times at Maine Medical Center up to 50 new grads, and system-wide, probably, as this happens, over 200 new grads a year, if not more. I don't have the exact figures. So I would suggest checking out our career site. I also want to just put out there for Odette's team on the next slide, we are doing an open interview event for patient care support services on Wednesday from 1 to 3. It's a virtual event. Keep everyone safe. Opportunity to speak with a member of my team, of any of all the recruiters, or members of Odette's team to learn about opportunities within housekeeping, food services, and security within Maine Medical Center. The link is on this slide, but also it's on our career site. And Andy, if you go to the very last slide, there are those QR codes. If anyone wanted to scan those will bring you to ways to search for opportunities or to join our talent community. And the email address at the bottom goes directly to the talent acquisition coordinator. So again, talent acquisition oversees recruitment process for a director positions and below, clinical, non-clinical, everywhere around. So, and if we aren't the right positions, I partner with executive leadership, physician, and so on. So, sorry, talking quickly. That's what I had to say.
Well, Thank you so much, Melissa, Marie, Melissa F., Bailey, Kevin, John, and Andre. This was a great team collaboration.